Well, good evening, everyone. Welcome to our health condition workshop at BioTouch. And today we're going to talk about diabetes. My name's Paul.
Good evening, everyone. This is Bev.
And go ahead, Bev, why don't you introduce our guest speaker this evening?
Yes, Paul and I are very, very happy to introduce Lindsey Parsons, EDD. Lindsey is a certified health coach who lives and works in Northeast Tucson, and her approach to things like diabetes, autoimmune, and gut health issues is all natural. So we're looking forward to having her present tonight. So at this time, Lindsey, I'm going to turn it over to you.
Thanks so much. I appreciate you guys having me. So happy to get the PowerPoint going.
Okay, hold on here. Go ahead and say something. I'm not sure it's taking here.
Okay.
Can people hear us out there? If you can, post it. Hi, everyone. Goof evening to you. Taboos, good evening. Can you hear Lindsey out there in La La Land? Give us a little note here. I guess they can because nobody's. Yep, we can hear. All right, Lindsey, you're on.
Okay.
All right, wait, let me get back to this one. Technical things. All right, you're on. There you go. PowerPoint and all.
Don't yet see the PowerPoint. Maybe that's my view. Yeah, I'm not seeing the PowerPoint myself. But I can...
Oh, on the Facebook? There it is. It's on now.
Okay. Yeah, no, I'm not seeing it, but that's okay. I'll just pull it up on my own screen, and then I can go along from there. Okay, so there are two types of diabetes, primary types, and I'm going to be focusing mostly on type 2, but I'm going to just go through the types to start with. So the first type is usually onsets during childhood, and it's an autoimmune disease, and that's type 1 diabetes. And if you are diagnosed with that, typically you'll be insulin dependent for the rest of your life. Although I have heard of some people out there in the functional medicine community who are helping children reverse the autoimmune process and not proceed to full type 1 diabetes. Then type 2 is the one that's become more and more common over the last, 30, 40 years. And that typically onsets during adulthood, although now because of the kinds of foods we eat and our lifestyles, we're actually seeing now teenagers in their late teen years getting type 2 diabetes. This type of diabetes is very much lifestyle dependent, and it can be reversed if it's caught early enough. And that accounts for about 90 to 95% of the diabetes that's out there. And then, of course, there's gestational diabetes, which happens during pregnancy, and it increases your risk later on of getting type 2 diabetes. And most importantly, it increases your baby's risk of becoming obese as a child or a teen or having type 2 diabetes later on in life. So it's really important to be careful about that if you're getting pregnant, to have a low sugar diet. So in terms of actual diagnosis, if your fasting glucose is between 100 and 125, you'll be diagnosed with prediabetes, or your hemoglobin A1C, which is a longer-term measure that looks at your blood over the course of the previous few months. And if that's between 5.7% and 6.4%, that's pre-diabetic. Then type 2 diabetes is officially diagnosed with a fasting glucose above 126 or 6.5% hemoglobin A1C on more than one test. So when we're talking about diabetes, the hormone that's at play here is insulin. And insulin is produced by the beta cells in your pancreas. And its role is to move blood sugar, which is in the form of glucose, which your food will convert to, into the cells for energy. And and your body is always trying to maintain a normal level of blood glucose, because when you get too much glucose in the blood, it causes all sorts of havoc in your body. So your beta cells will release the insulin, and that will regulate your blood sugar and always keep it at a very stable range. Now, if you eat too much sugar, which we all do these days because it's in everything, added sugar is in almost every food you buy in the grocery store, 80% of the things in the store have added sugar, then that extra sugar is going to have to be stored into your liver. And then when that happens, you start getting problems like fatty liver because you get this excess buildup of fat. And then your blood sugar is going to be dysregulated, meaning you're going to have real big highs and lows on your blood sugar as opposed to keeping it stable. Now, on the other side, if your blood sugar goes low, your pancreas releases a hormone called glucagon, which will cause the liver to break down the stored sugar in the form of glycogen. And then that will increase your blood sugar. So it's just a constant process of back and forth. So you can then guess that if your blood sugar is constantly high, that fat in your liver is not getting broken down. So what happens over time is when we eat more and more sugar, we begin to have what's called insulin resistance. And that is when your cells, in particular your fat, your liver, and your muscle cells, are not responding correctly to insulin. And as a result, blood sugar is not getting into the cells to be stored for energy. And then over time, your pancreas is going to have more and more difficult time creating enough insulin to meet your needs and to bring your blood sugar down. So some of the symptoms of insulin resistance, or what's also called metabolic syndrome, are a waistline over 40 inches in men and over 35 inches in women. Or the other thing I've heard is you should just not, in general, you don't want your waistline to be more than half of your height. High blood pressure, fasting triglycerides over 150, skin tags or patches of dark velvety skin in your armpits, neck, groin, or breasts. So if it progresses beyond metabolic syndrome, you may then be diagnosed with prediabetes. And some of the symptoms of that will be fatigue, because if the cells are not getting the glucose to give you energy, then you're gonna feel fatigued. Excessive hunger, especially shortly after eating. So people with prediabetes and diabetes will find they eat a meal, but then an hour later they still feel hungry. Again, that's because your blood sugar is not, you have insulin resistance and your blood sugar is not getting to those cells to provide energy for you. And so your body's going, well, I didn't get what I needed. Then you'll also have increased thirst because you're going to be filtering out all that excess sugar through your kidneys, and that's going to take water. So you're going to be needing to drink constantly. And then, of course, because you're drinking constantly, you'll frequently urinate, and then you may also have blurred vision because of the inflammation in your corneas. So some of the long-term complications of diabetes are cardiovascular disease, stroke, kidney disease, nerve damage, because again, when the cells aren't getting an adequate supply of glucose, then they stop functioning properly. And then when you have that nerve damage, which you may have heard of, it's called diabetic neuropathy, you're not feeling when you do damage to your feet, for example. That's one of the biggest places. So you might hurt yourself, but you don't feel it in the nerves, and therefore you can't tend to it properly. So then it can get infected, and then that leads to amputations. It also can cause vision problems and even loss of vision over time. So some of the risk factors for type 2 diabetes are overweight or obesity, smoking, sleep apnea, weight distribution, so having weight around your midsection as opposed to distributed all over your body, inactivity, age, so the older you get, the more the risk, family history of it, race or ethnicity, all of those listed have higher risk, and polycystic ovary syndrome. So in terms of what will happen if you go to a regular doctor, an allopathic doctor for type 2 diabetes, one of the first lines of defense is a pharmaceutical called metformin. And if that isn't enough and you continue to go on, your blood sugar continues to increase, you'll be put on insulin of some forms, and there's various forms now, from injection to pumps to pens. There's even an inhaler, jet injections, and ports. Some people have continuous glucose monitors, and the insulin is released automatically, which is a huge advance, because the longer your blood sugar is dysregulated, the more damage you're going to have to your body. So there's nice advances in modern medicine, but of course I'm more of an advocate of the alternatives, which is reversing it, which I'll talk about in a minute. And then of course if things get extreme, bariatric surgery, and there's even artificial pancreases and then other kind of extreme treatments out there. So my realm is the realm of trying to change lifestyle so that you can reverse type 2 diabetes. So if you catch it early enough, then you can, before those beta cells are completely destroyed, you can reverse type 2 diabetes. And this is, it's very important to think about the fact that just because your parent or sister or someone in your family has had type 2 diabetes, that doesn't mean it's your fate. Maybe 10 or 20% of it is genetics, but the other 80% is lifestyle. So it's really important to make those changes to your lifestyle. And I'll just precede that by saying that, a lot of problems with obesity and type 2 diabetes come from childhood trauma. The more childhood traumas you've had, adverse childhood events, the more likely you are to suffer from these things. So the first piece before trying to change your diet is addressing that trauma or finding a program that addresses, if you have an eating disorder of some type, dealing with that, because it's very hard to make these kinds of diet changes before you've addressed the trauma that preceded them. So the first thing in terms of diet is to avoiding added sugars of any type if you're diagnosed with prediabetes or type 2 diabetes. In particular, don't drink your sugar. That's the worst way you can have it. And high fructose corn syrup is really bad because that just lays fat down straight on the liver and causes problems. Avoiding artificial sweeteners too is actually probably counterintuitive, but the studies have shown that people who drink diet soda have more type 2 diabetes than people who drink regular soda. And that may be because they've also studied that people tend to eat more, and it also just keeps you constantly craving sweets and sugar. Avoiding processed foods is also super important, in particular because those processed foods all contain omega-6 fatty acids, which are very pro-inflammatory, and the progression of diabetes is very much tied up with cellular metabolism. And when people have more omega-6 fatty acids, that is necessary for the type 2 diabetes to happen. It's a very complex thing that I'm not qualified to explain, but I can just tell you that if I were able to say one thing that you could do to your diet to avoid type 2 diabetes, I would say avoid seed oils. And we're talking canola, corn oil, safflower oil, soybean oil, all those oils, because if I tell you that means you can't eat any processed foods because every single processed food has seed oils. So I could tell you just that one rule and you could probably change your diet from that alone. Also avoiding grains and flours, even if they're whole grains, because the glycemic index of even like a whole wheat bread is pretty much the same as a regular slice of bread, and the glycemic index just basically says how quickly it can raise your blood sugar. Avoiding dairy, in particular lactose. And by the way, all of these recommendations are coming from a program developed by Dr. Brian Mole, who has Centers for Reversing Type 2 Diabetes. And then limiting your carbohydrates to 100 grams a day, so that you'd have to add those up from all things. There's great tools online now for keeping track of your carbohydrates. So I'm sure that you can do that. You can enter in foods and recipes and everything. Then another thing that is very useful in reversing type 2 diabetes is intermittent fasting. So at minimum, you want to have 8 hours at night where you're not eating. I mean, not 8 hours, I'm sorry, 12 hours at night where you're not eating. But even better, if you can move to a schedule of eating only during 8 hours, for example, and going 16 hours without eating. So a lot of people will have an early dinner and then they might not eat the next day until 11 o'clock, for example. Or having 2 days a week where you only eat a quarter of your calories or don't eat at all. For example, those kind of interventions can quickly reverse type 2 diabetes because it allows for that insulin to become regulated again. But in general, if you're just going to eat a regular diet and just try and make a lot of diet changes, eating every 4 to 6 hours is ideal. Snacking and eating throughout the day is not, unless you happen to be hypoglycemic. And then an exercise regime that includes not only aerobic exercise, but also weights, because the more muscle you have, the more places you have to store glucose, and interval training will all be helpful in reversing type 2 diabetes. And in terms of what you should eat, protein. So if you're trying to lose weight, and most people with type 2 diabetes, although not all people want to lose weight, the recommendation from the research is 1.8 to 2.2 grams of protein per kilogram of body weight. So that's a lot of protein, probably way more than most people eat. And you'll find that, like if you're thinking about how many grams, like a 6-ounce steak, for example, would have 51 grams of protein. So if you weighed 200 pounds, then you might need something well over 100 grams of protein a day. So you might need to be eating, essentially 6 ounces of protein of some sort, and then maybe a protein shake or something. So it's just a lot more protein. You want to shift your diet really off those carbs and onto the proteins and the fats. Of course, increasing vegetables. We can all afford to eat more vegetables. And then in terms of fruit, you can eat fruit, but the low sugar fruits like berries and lemons and limes and cherries are better choices. And then increasing your healthy fats. So that's like olives and extra virgin olive oil, avocados and avocado oil, coconut products and coconut oil, ghee, which is clarified butter, nuts and seeds. And then limiting your starchy vegetables, in particular like your white ones, like potatoes, and peanut butter, especially sugary peanut butter, and the more sugary fruits, of course, all the added sugars, and then sugar alcohols like xylitol or erythritol. While they're better choices than actual sugar, eating those in limited quantities. Better choices, if you do want to sweeten something, of course, are stevia and monk fruit extract. And then there are some good herbs and vitamins and nutraceuticals for people with type 2 diabetes. One of the most common deficiencies, because we don't eat enough green leafy vegetables, are B vitamins. So B complex is a good place to start. And then another supplement that most people tend to need because we just don't get enough in our diet, which is also tied to depletion of the soils, is magnesium. And generally, I tend to recommend magnesium glycinate if you are not constipated, and magnesium citrate if you are constipated. Then alpha-lipoic acid is another one that's really important for helping to digest carbohydrates correctly and regulate your blood sugar. Berberine is one that's used a lot now for type 2 diabetes. Chromium also helps you with blood sugar regulation. Cinnamon, Antonia latiflora, and then a fish oil that's very high in EPA and DHA. So, if you go to the store and it says 1,000 milligrams, but then you look on the label and there's only 250 of EPA and DHA, that's not a good fish oil. What you want is one that's, like I get one that's 1,400 milligrams, 1,000 of which is EPA and DHA. And then there is a new probiotic out, and this is really an interesting new development because it's intervening at the level of the gut microbiome. And what they have found is that people's gut microbiomes influence their tendency to become diabetic and to gain weight. And so one of the bacteria that lives in our gut is called Akkermansia muciniphila. And in particular, people who don't have that in their guts tend to be more overweight and have more type 2 diabetes. And so there is actually there's two products. There's one called pendulum glucose control that is a combination of that strain of bacteria and some other strains. And then there's one that's just straight Akkermansia muciniphila that this company Pendulum sells. And they have been shown, the glucose control in particular, has been shown to reduce hemoglobin A1C by 0.6%. So just by essentially taking a probiotic, you can reduce your A1C and also reduce meal-related glucose spikes by 32.5%. So I wanted to mention those in particular because they're kind of unique and you might not have heard of them. And I can pop that information too into the chat box about where to find those. So that is everything I was planning to cover.
All right. Whew, man.
I don't know if I could have handled it anymore. That was amazing information. I got to say, for me personally, I think the aha was, I've heard of fatty liver. I had no idea fatty liver was an overload of sugar in the liver.
Yeah, because you think of fat, and so you think, oh, I eat too much fat, right? But no, it's the opposite. People gain around the midsection usually because they're eating too many carbs, and the 30 years of telling us we weren't allowed to eat fat was just way off.
Right. That makes so much sense. That was pretty cool. The other thing that stood out for me was when you mentioned that a lot of things that lead to things like type 2 and these autoimmunes is the childhood trauma. Mm-hmm. I just think that is such an important link that is now coming into a lot of people's minds, a lot of therapists and doctors. We have no idea. And of course, I'm sitting here, all the things you're saying, going, "Ooh, biotouch! Oh, biotouch!"
Yeah. Right. Well, I work with people to help them lose weight, but if they come with an eating disorder, I'm kind of like, you need to go back and see a therapist because I can't. if you can't follow my instructions, I can't solve that problem for you.
That is so profound. Really.
Yeah.
I mean, that really stood out for me. Yeah.
And so that's sort of that lead in of how do you work with people, and that's sort of cool that you know your limit. You don't work with the trauma patient and their emotional psychological problems. You send them on to someone. That's
They kind of do. You kind of do as a health coach, but I do find that if the trauma has not been addressed, then it's very hard to make any progress around eating disorders,
right.
binge eating.
And so what do you do in your particular we show, so just so people remember, we're going to send out this PowerPoint that Lindsey just presented so that you can get more details, and on there is her contact information. So just once again, tell us what you do and how people can contact you.
So I work as a health coach, and that means that I typically either work with people for 12 weeks if they're trying to reverse type 2 diabetes and lose weight, and meet with them every week for an hour and coach them through all of the things from the behaviors to the actual foods you're eating to lifestyle factors. Incidentally, I didn't mention one super important lifestyle factor, which is poor sleep. So in terms of blood sugar dysregulation, one night of bad sleep where you're just getting 5 hours will dysregulate your blood sugar as much as 6 months of a junk food diet. So getting good sleep is super important. So we'll deal with all the different lifestyle factors that can contribute to type 2 diabetes. Some people do lab testing, and we get into more complex stuff. And then I also see people for gut health issues. Usually I set up a sort of a 5-appointment sequence for people who have irritable bowel syndrome or inflammatory bowel disease or kind of undiagnosed stuff that they can't quite figure out, and help them with that.
Perfect. So we're showing on there High Desert healthcoaching.com. She also has a podcast, The Perfect Stool, Understanding and Healing the Gut Microbiome. That's a cool, Perfect Stool.
I saw that.
Oh, perfect. Well, let me see if there's any questions here. No, you must have hit everybody's points to it. If there are questions and you want to email them to us or to Lindsey, we'll pass them on to her, or you can go directly to her. And we appreciate your time, Lindsey. That was a whole slew of information for us to digest.
Yeah, that was very, very well presented. Yeah. Thank you.
So thank you, Lindsey, and we'll just switch the format here to teach you how to do BioTouch now. Thanks, Lindsey.
Thank you, Lindsey.
Woo! Wow.
Yeah.
I love these speakers.
I know.
It's like you just get inundated with stuff that you never even thought about. So now diabetes, it's like, I mean, we have this workbook, which, by the way, if you're here and you want to learn it, go to justtouch.com/workbook before Bev gives you the points, and we're going to go over those. But God, you could add something like the headset in this too, because it becomes vital for your state of mind, your diabetes, or sleep.
Right, yeah, absolutely right. We say everything's connected. Man, I mean, childhood trauma leads to eating disorders, can lead to type 2.
Right. And sleep.
Oh my God.
I mean,
yeah.
Getting little sleep is like 6 months of blood sugar problem. I'm like, what?
Huh?
That's crazy.
That's crazy. Oh my gosh. That was great.
Yeah. All right. So for all of you out there, again, justtouch.com/workbook if you want to download it for free this month. Otherwise, members can download it at any time. And we're going to switch format here. So Bev is going to be the teacher, and I'm going to be the stooge behind the scene. Speak up as loud as you can here, because I'm not. You're not coming through there. You're going through our speakers. So I don't know.
Oh, okay. Can you hear me?
Yeah. So it's picking it up on my microphone. So.
Okay.
All right. So let me go to the health condition and make sure that the first page is showing up here. All right, take it away.
What is BioTouch? So we like to do this at the beginning of every health condition workshop because hopefully there's some new people joining us each month, and we just like to give a little overview so you get familiar with BioTouch and how you can learn how to use it immediately and be effective. So on this page 6 that Paul has up, what is BioTouch? So let's go over these 4 bullet points and begin by just saying to you that BioTouch is a very light touch using the first 2 fingers of the hand, and it's lightly addressed on the skin like a butterfly, we say. It's a light butterfly touch that can literally address every health condition the body can manifest. So we've seen amazing things that you wouldn't even, from a bruise, believe it or not, and the reason is because BioTouch actually works in conjunction with the body. BioTouch is like a tool that you can give the body, the recipient's body, and if the body knows what to do with it. Our bodies are very intelligent, a holistic unit. It knows what to do. So BioTouch is it's not what we call the associate, the one who's touching. We don't talk about things like we're healers or we have the power to heal. BioTouch is just simply touched on the body in specific points on the body, so that the body can use BioTouch to start addressing what it wants to fix. So BioTouch is very easy to learn. The first bullet, even children can learn it and practice it, and that is very true. We've seen it over and over again. In fact, children, they don't have all the hang-ups we do, over analyzing everything, that great ego that gets in our way. And so it's kind of innate in all of us. So if we act as a child and just trust ourselves and BioTouch, we can actually step in as a child, create a safe place for another person that we really care about, to help them address pain and stress, whatever's going on with them. And when you do, you're going to be immediately effective. So the next bullet is that BioTouch is a complement to any healthcare program. And that is very true. And we've discovered over the last couple of years that it's not just complementary, it is integrative. You can use BioTouch. It enhances everything that you may be doing, whether it's a specific diet, as Lindsey was talking about tonight, changing a lifestyle as in a diet, you're maybe going to another practitioner or another, going through therapy, you're under a doctor's care, you're taking pharmaceuticals, whatever you're doing, BioTouch is only going to enhance that journey. So very, very complementary and integrative, because we are a holistic system. There's different parts of ourselves, and BioTouch is here to integrate with everything else that's going on and bring the body back into balance. The third bullet is BioTouch has no levels of ability, and everyone is effective, as I said, the first time that they touch. And this is a really unique part of BioTouch. We know that every single one of us, everyone, has the ability to practice BioTouch. That is one thing we know. You do not have to go through years and years of training, levels of training. You don't have to be sanctioned by a guru or a master to be able to be, good enough to touch. You just have to learn the simple points in the technique, and the minute that you touch another person with BioTouch, you are effective. I'm not going to say it's pretty unique. It is unique. And that's why we are so excited about BioTouch, to bring that to you, because you already have what it takes to practice BioTouch. The last bullet, it requires no special preparation, belief, or state of mind to be effective. You don't have to prepare a space so that you can help someone else with BioTouch. In fact, BioTouch is effective anytime, anywhere, with anyone, whatever's going on. You can be on a bus, you can be walking down the street, you can immediately, you have your tools. That's all that's required, those two fingers. Everything else is just you knowing where to touch on that body. So there's no, you don't have to, all this stuff about I'm the healer and you're the one being healed. You don't have to enter into any of that with BioTouch. You just have to want to help someone who is in stress or pain. It's all about just caring about someone and making them feel cared for. That's all that's required to practice BioTouch with another human being. That's it. So again, what we do is before you start practicing BioTouch, you always want to wash your hands, and then you begin the session with what you're going to learn next, the greeting, and then you just use the first two fingers of both hands, and you touch very lightly on those points, holding each point 6 to 8 seconds. That's it. That's all you need to know in order to learn to use BioTouch. So, Paul, anything else you wanted to add?
No, that's clear as it can get. It's so simple. Let's just go right on to, it shows the terms next. We're not going to go over that, yeah?
Right. Yes. That's just...
You did go over the associate, though. That was good.
Yes.
So let me go...
BioTouch creates a relationship of healing between two people. One that is giving the BioTouch, called the associate, and the one that's receiving is called the recipient. And right there you have what? A relationship of equality. Yes.
All right.
Okay, well then let's go on to teach the greeting. This is, as I mentioned just a few minutes ago, the greeting is always performed before any other point on the body is addressed. You must do the greeting. It really is the key that unlocks the body to start receiving and acknowledging BioTouch. So you always have to do the greeting before anything else. And we're going to be watching the video, so it will be explaining how you perform the greeting.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same two fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be reestablished. Then the session. The greeting is always performed at the beginning of each session. It's the only
I am.
Something's crazy. I don't know how this is taking, but you got the idea. 6 to 8 seconds. You just
Oh, I
touch.
love this Zoom.
I know it's. I can't figure out what's happening here. It took it and then it didn't. So anyhow, just below the breastbone for point one, just to the left of the big bone for point two. All right.
Point two. And yes, and make sure you use your dominant hand.
Yeah.
Don't know if that came through on the video, but just to reiterate that.
So let's instead of showing the video, let's just talk about how to do metabolism.
Okay.
So you can go ahead and describe those first 3 points that are on the front there.
Okay. So as Lindsey was saying, the metabolic, whatever term she used, is really important in dealing with type 2 diabetes. So the metabolism set actually has within it one point that addresses blood sugar issues. And it's a set that helps the body to assimilate what it needs and to eliminate what it does not need. So there are 2 different parts to this set. So the first part, as you can see, if you're looking at the workbook, are the front of the neck, that large muscle on the front of the neck, points 1, 2, and 3. And so what you will do is what we call in matching fire. So you're going to be using both fingers of the first 2 fingers of both hands and touching those points 1, 2, and 3 simultaneously. So point 1 and 1, you can see right above the collarbone. Points 2 and 2, halfway up the neck. And points 3 and 3 are at the top of the neck. And remember to hold each one of those points from 6 to 8 seconds. So that's the first step in addressing and using the metabolism set. The second step is, if you'll look at this X, so the X usually indicates a hold point, where with one hand you're actually making constant contact with the skin while you're using the other hand to touch other points. So as you can see, our hold point is on the front of the body. And it's actually located, here's the breastbone. If you see the breastbone, it's actually in a line with where we might find the nipples on a youth. And then we want to be 1 to 2 inches to the left of that breastbone. So you're holding constantly on that point. And then if you look at the next diagram, you'll see the back. And we're going to be working, it looks like a rectangle. And it's below, those points are below the shoulder blades and above the hips. So if we're looking at point number 1, that dotted line that comes up is kind of a natural curvature of where the ribs join the spine. In fact, it is exactly through the body from greeting point 1, tissue, soft tissue just below the breastbone, straight through the body. So you're going to be working in a rectangle around that reference point, basically. So point number 1, we're going to be, there's the spine. 1, 2, and 3, and 4 are actually on that large muscle. So point 1, as you're holding on the front, would be on that, what is that? The left muscle,
right.
Left spine muscle. Number 2, point 2 would be directly across on the right spine muscle. And we're going to be about 1 to 2 inches above that breakover point. For point 3, you see it's a little bit further down. It's about 2 to 3 inches below this breakover point on the right spine muscle. So that in itself, that point, those first 3 points on the front of the body and those 3 points on the back is actually the metabolism set. But what is really great is that point 4, directly across from point 3, is the blood sugar point. So that is what you really want to address if you are working with somebody that has diabetes. And we have seen just incredible results from that. So you want to do that whole set. The first step of points 1, 2, and 3 on the front of the neck, and then those 4 points on the back. 1, 2, 3, and then that 4th point for sure for blood sugar.
And I think,
yeah,
I think what's important for sure is for people to understand. Yeah, we've had real good results with this, and a woman who was on a pump was able to get off the pump from her insulin that had to be pumped into her. So
right.
Always remember, when you start adding that 4th point, you're working with diabetes, you must work with your healthcare practitioner so they can monitor how much insulin you're taking.
Yeah, that little butterfly at the top of the page there, the natural healing processes of the body may begin to exert an influence on the body's need for insulin or other medications. And we always encourage recipients to work with their healthcare provider. If something changes, because it may, if something changes, then, that's part of that self-awareness that we're always talking about. That you need to take responsibility and go see your doctor if something has changed, because glory be that you don't, that insulin may be reduced. That's what happened with one of the girls that work with us. So it's very important, as Paul says, to just be vigilant, and we encourage you to work with your doctor if you're under a doctor's care.
All right.
Anything else that I missed on the metabolism?
That's metabolism. And again, there's the drawing, and then there's the photographs with the words exactly the way it's stated in the video, which we're not able to play. But if you'll notice on each page, there's a click to the video, and that'll take you to our website to show you later on.
Show you the video, and it's really great. So do that, and you can actually see someone performing those sets of points on another person. Okay, and the third set that we really recommend, of course, stress and anxiety. The body is under all these physical manifestations of emotional and mental stress, and of course I'm thinking about some of that trauma that Lindsey was talking about, and it comes out in physical manifestations. So this is a really great set, the stress set, to just help with that anxiety, helps the body to deal with that. And it really helps the person to feel more cared for. So this is a very easy set. As you'll notice again, right at the bottom of the ribs, on that soft tissue just below the breastbone, here's that X in the circle. That indicates again a hold point where two fingers of one hand are making constant contact with the skin, while the other hand is touching just 2 points, 1 and 2. So in this set, you're going to visually imagine a line that starts at the top of the breastbone, in that notch right there at the top of the breastbone, and you just kind of visualize a dotted line to, again, the nipples where they might be on a youth. And then you're going to just divide that line into thirds. So we see point number 1 is at the top of that first third. And again, we're on that diagonal line going towards the top of the breastbone. So point 1 right at the top of the first third, and then point 2 again at the top of the second third. Remember, touching very lightly. BioTouch is a very light touch modality, holding 6 to 8 seconds each of those points. And always, you may repeat. If you want to, you can repeat those points.
All right. Wow. That's how simple working with diabetes is. There's also a little work I think it's in the workbook there, where you can locally work on problems. So when she talked about neuropathy problems, I mean, I've worked with people who were almost ready for amputation. It was so bad. And we were able to help them heal, get their blood sugar, and get that leg, the foot, to not have to be amputated with. But even if you do, there's nothing finer than doing BioTouch pre and post op. Gets you ready for the operation and gets that body healing. So we're not saying BioTouch will reverse everything, but it can certainly help you even with an operation or whatever medical procedures they need to do to keep you alive on the planet.
Right. Absolutely.
With a high quality of life. Right.
Yeah.
So, sorry about some of those technical difficulties. Again, if you're just tuning in, get your name on our email and you will be able to get the replay of this in an email with the PDF files that Lindsey had. A lot of information there. If you have any questions for us, contact us, office@justtouch.com, and we can pass that on to Lindsey or hook you up with Lindsey if you need a personal coach for that. Otherwise, do the BioTouch, do it at home, do it with your family, get the kids doing it on whoever in the family's got the diabetes, and if we can be of any help, let us know.
Definitely. We're here.
All right. Bev, good job. Even with our technical difficulties, you did a good job teaching.
I got to revisit my old instructor days.
That was good. So again, next month we move into, I can't even remember what it is in January. It's like I don't have the list up here.
But you will know when we know.
That's right. You will know.
We will be putting that out soon.
So we go back to our fourth Thursday of the month in January, and we hope to see you there, or come learn BioTouch through some of our classes. Join us on Mondays with Bev and Paul, and whatever we can do to help you learn BioTouch, we're here. So thanks, Bev. Don't hang up, because I need to figure out some stuff here. So otherwise, we'll see you all.